Good morning, everyone. My name is Dr. Richard Horowitz. I'm the co-host of the Healing from Lyme Summit, and it's a great pleasure to introduce to you Rachel and Dorothy Leland. They are the authors of Finding Resilience, A Teen's Journey Through Lyme Disease, and we're going to discuss a mother and daughter's journey through Lyme disease and what it took to get Rachel eventually better. So we're going to discuss today the journey that Rachel started on at age 13 when she got sick. She was seriously disabled for what turned out to be Lyme disease and co-infections. But of course, they didn't know this at first, the way most people don't. And the book tells not only Rachel's story, but also that of her mom. And passages written by Dorothy are interspersed with Rachel's, offering a unique picture on how Lyme disease can affect the whole family. So Rachel, we're going to start off with you. Why don't you tell us a little bit about yourself? You were a healthy young athlete, then things started to go terribly wrong. Tell us about your story a little bit.
Yeah, I was 13 years old. I'd been a year-round soccer player. And for the past couple of years, starting probably about like 10 or 11, I had a lot of knee pain that we noticed when I was doing soccer, but it didn't slow me down other than just we were aware of it being there. But we went to doctors and they were like, you're just growing, it's fine. But then on March 12th, 2005, I was 13 and I fell in a soccer game and I sprained my wrist. And although we just thought it was just a wrist injury, within 2 weeks, I was just in body-wide pain. I was on crutches. 2 weeks later, I was in a wheelchair, mostly from knee pain and ankle pain. But I'd only injured my wrist. And we were very, very confused. And it started us out on this journey of trying to figure out what was causing all of these symptoms.
So question, when you started getting these aches and pains, a lot of the Lyme patients that I see, they have migratory pain, migratory joint pain, migratory muscle pain, migratory nerve pain, tingling, numbness, burning, stabbing. Do you remember at the time whether you had any migratory pain when this all started?
Yes, and it was very confusing because, again, I'd fallen on my wrist, but then all of a sudden my ankle hurt and then my other ankle hurt. And so one day I'd have like my foot would feel like it was on fire, pins and needles. And then the next day, the other foot would feel like that. And then my knee hurt. And eventually both knees hurt, but it moved around a lot, which was very confusing and makes it so that it's hard for people to sort of believe your story that you're injured or something real is happening when it keeps moving and your story keeps changing.
Right. So the migratory aspect was there, but none of the doctors early on actually knew to ask you that question, right?
No, not at all. In fact, they questioned my story as soon as it started moving around.
Got it. Okay. And Dorothy, what was going through your mind while Rachel was getting this sick? What was happening?
Well, my child was deteriorating before my eyes, and we would go to doctors. We had, good relationships with doctors, we thought. and but as it got weirder, they were starting to not believe us. Like you were talking about the migratory, it was like that was in their mind, that was proof that this wasn't real, or that, she was making it up. And it was terrible because the people that we were turning to for help were shining us on. And my child just seemed like she was, just going down, down, down. And on top of the physical stuff, she was scared. We were all scared. She was kind of depressed and crazy, and just it was awful. It was just simply awful. And there was no place to go where somebody sort of said, okay, let's just look at the whole thing here, let's see what all of this is. It was just done in this very piecemeal fashion.
And so and obviously she was in perfect health before this. So there was like no reason to suspect, for example, that this would have been psychiatric, because a lot of the doctors, and you know this from personal experience, when they can't figure out what's wrong, they tell patients it's in their head, right? Although Rachel was completely healthy. Obviously, not somebody normally had psychiatric issues, and that doesn't usually cause those kind of physical symptoms. So how many doctors did you end up having to take her to before you end up figuring this out?
I've never sat down and made a list. We went, in addition to ones in our group, our medical group, we were referred to a children's hospital, and there was a whole bunch of practitioners there. And then subsequently, when she actually spent a month in this hospital that supposedly had a pediatric pain unit, but it became clear that they were operating from the assumption that pediatric pain came from psychiatric reasons, and the fact that she had an overengaged mother was part of the problem. It was like the fact that I was trying to help my daughter was evidence that I was hurting my daughter. So that was a very, just a very troubling time for the whole
Almost
family.
almost like a Munchausen kind of diagnosis, like there was really nothing wrong with her and you were enabling the whole.
Right. They did never use that word. They never used that word. But it was that kind of thing. It was that I should chill out, and this would all go away.
And
And
any of these tests they did, I mean, being a month in the hospital, that's a long time for this. Any of the tests that they did give any clinical clues that you remember at the time? Did they bother checking a Lyme ELISA, didn't know the sensitivity, or they didn't even think in Northern California that Lyme and tick-borne was a problem? Because I know California it's underestimated in general. They even though, of course, it's spread throughout the state. So were they not even aware that there was a problem with Lyme in your area?
well, it happened that early on in our process, before she was in the hospital, but when we were going to all these doctors, I mean, there had been various scans, there'd been an MRI of her wrist, and that was really a turning point when the MRI didn't show anything wrong with the wrist, and yet she was in this immense pain. It was like there was a real shift there, and it was like, oh, okay, this is really all psychiatric, because there's nothing wrong with her wrist and she says it hurts. And it was just, I'm sorry, I lost my place in what I was saying there.
The Lyme test.
Yes, the test. So there were various scans, there were that sort of thing. But there was a neighbor had said to us that, do you think this could possibly be Lyme disease? Because they knew somebody that had a similar situation, and that's what it was. And so we asked, and they practically threw us out of the office. It was like we didn't know that those were dangerous words when you say Lyme disease, them's fighting words. And it was like, no, absolutely not. No Lyme disease. Can't be Lyme disease. So when she was in the hospital, they were just going off the original ELISA that had been done before. And they just said, there's no reason to pursue that because she's negative here. And I was starting to learn more. And I had found that there was this thing called a Western blot, but I didn't know enough to know that it depends on what lab you go to. So they finally did order a Western blot, and it said that it was negative, but they wouldn't, even though I asked, they wouldn't even give me the paperwork that came from it, so that we could know anything about it. They just said it's negative. And
Right.
so it was a very bizarre time. And when we finally left the hospital, they were just, these very important specialists were telling me, there was a whole committee of them that sat me down and said that, that she just needed to get over this. She needed to continue having therapy, psychiatric therapy and physical therapy, and that I should give up my thought that it was actually written in the hospital records that the mother had an unrealistic suspicion that this was Lyme disease. That was
Right. I mean, of course, it's unrealistic when they see a whole team of doctors. Your daughter's in a wheelchair. She can't walk. She's suffering. And God forbid you as a mother should actually say, well, gee, my daughter's been fine her whole life. She's not a psych case.
Yeah.
I mean, it astonishes me. And by the way, when they wouldn't give you the Western blot results, this was through a local lab like Quest, LabCorp, BioReference.
I finally got it. I don't remember what the lab was, but it wasn't IGeneX.
Okay.
It wasn't IGeneX. And it was something that, as I said, it's been years now since I looked at it, but it was just the one that doesn't test for the bands that count.
Oh, so
And
they had left off like the 31 band,
right.
right? And okay.
Absolutely. And they just said negative. And when I asked them anything more about it at the time, they just said, it's negative. That's all you need to know.
Yeah.
And I don't think, it was very bizarre. And it was time to move on.
Yeah.
And once we were on our own, basically, kicked out of the hospital and told to, go away, we did finally go to, I was looking for anything, and we finally went to a local acupuncturist and herbalist, and he was the one that said, I think we're dealing with Lyme disease here. And I was going, oh, well, all these other people that I talked to said, couldn't possibly be Lyme disease. And he said, I think it's Lyme disease. But he even said that he didn't know how to deal with it. And he said, you've got to find somebody that knows how to deal with it. And so at that point, it was like, okay. And so then I really turned to online patient support groups, because those were the only, this was 2005. There wasn't Facebook, there wasn't all of these other kinds of sources. There weren't even the organization that I'm now heavily involved with didn't have much information on its website at that time.
Right.
And so it was really the online support groups that there was. California Lyme was one of them. And it was a Yahoo group. And I found a doctor through that, and I found information and other kinds of sources. There was very little information out there. There were very few books with the word Lyme in them, even listed on Amazon. It was just right before a lot of this stuff, came to the fore. Well, your book, and I don't remember what year your book came out, but I mean, that was.
Well, Why Can't I Get Better came out in 2013
Right.
as a New
This
York
was
Times
05.
bestseller.
Yeah,
Yeah,
this
no,
was
it
05.
was 8 years
So
later.
there just wasn't the information. It just wasn't there.
Right.
And so anyway, so then we did find an ILADS doctor that was 2 hours from our home. And that started our lives just pivoted in a different direction at that time.
Got it. So Rachel, your mom's searching. She's searching. She's like desperate. She loves you. She wants to get you better. What was going through your head at this point? You had all these doctor visits. You're in the hospital for a month. Nobody's giving you any answers. What was going through your head during this entire time?
It's like that hospital was a really pivotal time in my life, because I went into that hospital very innocent and believing that we were going to find answers, and believing that the medical community and that doctors were going to help us, and they were going to just we were drowning and we really needed someone to help us. And so we went into the hospital and I fully believed that they were going to help us. And then we left the hospital, and I'd been told that I was just looking for attention and that I wanted to get out of school. It's like, I couldn't fathom. I loved school and I loved soccer. And those were the two things that were now hard to go do, or impossible to go do for soccer. And so that just didn't make any sense to me. And I spent a month telling people that I was in pain and just being flat out told that I'm not, and that that's not the reality. And so I left there so much worse off. And I was barely walking. They had taken the wheelchair away and wouldn't let me have crutches, wouldn't let me have a wheelchair. So then we went home. I basically didn't leave my bed for the most part, except for when I absolutely had to. And I was in so much pain. So it's like leaving that hospital, my mental state just deteriorated, because everything that I had known to be true was questioned. And then I was also just feeling so much worse because of it. And so at this time, I didn't even know my mom was looking. I mean, things were so bad that mentally I was just really struggling. And so, I mean, I didn't really know she was looking until she finally said, we have an appointment the day before Thanksgiving in 2005.
So
But yeah, things were hard.
when you were suffering this way, I mean, you mainly focused in the beginning talking to me about migratory pain, which is the hallmark of Lyme. And by the way, for those people who are listening and tuning in, there are only 7 diseases in medicine that cause migratory pain. Acute rheumatic fever, hepatitis, people with Crohn's disease or inflammatory bowel disease, people who have what's called Reiter syndrome. They may have Salmonella, Yersinia, and it affects their joints. Really, lupus will cause it early in the course of an illness, and gonococcal arthritis. And by the way, and I used to joke with doctors, unless you're at the bottom of your medical school class, those other 6 diagnoses, pretty easy to be able to tell migratory pain, Lyme disease from those other 6. So did you have other systemic symptoms? Because, for example, co-infections is the rule in my world, and I know you diagnosed with them, mostly with the bees, Babesia bartonella with Borrelia Lyme. Were you having like day sweats, night sweats, chills, flushing, air hunger, Babesia symptoms? Were you having those symptoms?
I was having every symptom that you just said. Yes.
Okay.
And so, and yeah.
And none of the doctors asked you about those symptoms?
They either didn't ask or they didn't care. I don't remember. At the time, my biggest issues were severe knee pain, severe back pain, and my shoulders were so hypersensitive that like any touch, my clothes bothered it, but like any touch was absolutely not okay. So those were like my biggest thing was pain at that time, just constant pain.
And those symptoms, by the way, you're describing when clothes touch a joint or touch your skin and is so sensitive, that's called hyperesthesia in medicine. That's basically a form of neuropathy, right? That's when your skin is so sensitive you can barely touch it. And it tells the doctor, right, if they've done this for a while, that is a symptom of neuropathy. Were you also having the multisystemic symptoms of fatigue, headaches, brain fog, cognitive issues, chest pain, shortness of breath, palpitations, difficulty falling asleep, waking up? Were you having a lot of those other symptoms?
A lot of those symptoms, basically all of the symptoms you just said, they started pretty much when we started antibiotics. So once I saw the Lyme doctor and we started antibiotics, then every symptom you could imagine just piled on.
Right. It came out like a Herxheimer reaction. It came out when you were kind of pissing off the bugs.
Yeah, it came out and then it just like never left. So.
And this path, when you got home and they wouldn't allow you to be in a wheelchair or work with crutches, how long was this going on for at home that you were suffering this way while your mom was looking for answers?
We went home in August. And then we had in November is when the Lyme appointment was. So from August to November.
But we got, even though they forbade us from having the wheelchair, we went in October and rented a wheelchair again because it was just, it was just clear. It was when she was home, we actually would push her around or she would scoot herself around on a wheeled office chair, because that was something that we could do at home. The wheelchair wouldn't work. But with school, it was just impossible. It was just impossible. If she was going to get from one place to another, she had to have a way to do it. And so we went back to the wheelchair. And, it's interesting. It seemed to me there's a whole psychology apparently around wheelchairs, and they often accused me, like when I would ask questions about something, and when I say them, I mean the before the Lyme doctor, the other people that we saw, they acted like the fact that I had gotten her a wheelchair had been like giving in to her. And, just enabling her. Well, it enabled her to go across the room when she couldn't do it otherwise. It was very strange. It was very, very strange.
Right. And Rachel, during this time when you were in the wheelchair and you were getting around the house, you were still in severe pain. You weren't sleeping. And I understand you were even bullied while you were trying to go to high school, and you kind of wrote about this in a journal. So what was your journal like at this point? Can you tell us a little bit about like what that experience was and writing about it in the journal?
Yeah, so we used my journal. I kept a journal. It ended up being over 500 typed out pages. And so that was a huge part of what helped us write this book. And so, yeah, we speak about bullying. I mean, I know a lot of people that have, bullying is a really big thing. That had never been something I dealt with. And then I show up at school in a wheelchair, and there was just one girl that took great offense to it. Someone that I had like never had anything to do with before. She'd just always been in the background. And she just like honed in and would just be telling me I was making it up and I was stupid, and she would be swearing at me. And it was just ridiculous. I mean, it was just every day. She would just see me and she would just say some hateful thing towards me. And it was very much, maybe she thought I was taking attention away from her because I was sitting in a wheelchair. I mean, it was very bizarre. It was in 7th grade.
Right. And did you have friends or support? I mean, high school can be a brutal experience for many people. I can remember actually the bullies in high school where I had to actually get in a fight once or twice to stand up, because it was like the only way you were going to be able to have them leave you alone is you had to stand up. But you're in a wheelchair, you're disabled. Did you have any friends or support in school with this, or you were pretty much alone at this point?
No, I was very lucky. I had a really good network of friends at home, but then also at school. And so, yeah, so I had a whole bunch of support, which I was really grateful for. So I was very lucky in that respect.
And were your teachers aware of the situation with the bullying and what was going on, or it wasn't something like you talked about with them? It was almost like you were a snitch. If you did, you had to put up with it. Like, was that kind of the milieu that you were in?
It was, in my mind, as a 13-year-old, I was like, I need to document. So what my friends and I decided to do, because they all saw it, it was out in the open that this girl was doing it. So anytime she would do it, we would get out the special folder or the special notebook, and we would write down exactly word for word what she said. And so then I made it very clear I wanted it to be exactly what was happening. And so I felt like once I got enough, then I could go to the principal. But she ended up finding out and grabbing it and ripping it up. So then that ended up bringing us to the principal earlier. But
right.
Yeah. And then they were aware of it, but they didn't really do much, but they were aware of it.
Yeah. So, a huge part of your story, right, is denial. The medical doctors, first of all, they didn't know how to take a proper history. They were in denial that there was ever a problem with a tick-borne. They were in denial, right, with Dorothy, with you, about the fact that you're a mom, knowing your child, right, knowing who she was, and that she was not making this up. So what was this like, just being in denial from an entire medical system that you're searching urgently, right, to get care? You couldn't get that care. And ultimately it came from, an acupuncturist, somebody who was outside normally the regular classical medical field. I mean, that denial must have been overwhelming. And I know a lot of, by the way, of course, my patients who come to me, I mean, I've seen over 13,000 people at this point during the last 40 years. The vast majority tell me the story of denial, that the doctors don't believe them, and that it takes 10, 20, 30 doctors. The highest, by the way, was 100. That is my all-time high, was 100 doctors before they finally got the diagnosis. So again, this denial with the medical system, it's a horrible thing. And at the time, of course, in the early 2000s, you're right. I mean, people didn't know a lot. But I will say, on the other hand, the disease had already been around at that point for almost 30 years, right? Alan Steer and those guys had already discovered this in the 70s by now. So what was it like dealing with this denial with everybody? I mean, already you were psychologically anxious and depressed. So, and then being bullied. I mean, I know your book is about finding resilience. And I have to say, I mean, my God, if there's any way to find resilience, it's like I have an illness, it's hopeless, nobody knows what's wrong with me, I'm being bullied, I'm being told it's in my head. How do you go from that to where you are right now? How did mentally you manage to get through all of this?
Yeah, so I mean, the denial thing, that is something that that was set in stone in my brain as a 13-year-old. And that's something I still deal with today. I go to a doctor for some random obvious thing, and I'm most concerned that they're going to not believe me. And so that denial just really set the foundation of never trusting any doctors, like for any reason, which I feel like in our culture, people think, oh, doctors, they're so great, you just do what they say. And that totally changed for our family. Like once this all started happening, we started being like, wait a minute, doctors are not the safe people. They are the most unsafe people I've been around. And it wasn't until we finally met our amazing Lyme literate doctor that we got to experience what like every doctor's appointment should be like. We got to that appointment, and I mean, it was 2 hours long, and he was just listening and fully believing everything we said, just believing it without question. And that was absolutely amazing. And so that was so important for us at that time, because up until then, everything had just been written off.
Right. And Dorothy, during this time, so finally you get over to this doctor, you're finally listened to. Did you have that feeling of validation that, my God, finally, right? I was proven as a mother that I was right, that, my child was sick. What did it feel like to you to finally have somebody listen to you after all those doctors you went through?
Well, it was a great sense of relief, and our whole Rachel mentioned it happened to be the day before Thanksgiving, late in the afternoon on Wednesday, because they'd had a cancellation, and so we went, and it was 2 hours away. The whole family went. Rachel's brother was there too, and we went, and we came home and sort of felt like we really had something to give thanks for the next day on Thanksgiving. And I think I might have noted this in the book. I don't remember offhand, but Rachel slept better that night than she had slept in months. She had really had very poor sleep, and she's like slept through the night. And that wasn't the end of her sleep problems. She continued to have sleep problems, but that night was really amazing. I think it was just a we just felt like a burden off of our shoulders. But the plot thickens once she started on antibiotics, and once she started herxing. There were some things that really really exploded in a bad way. And so it was a very hard time. And but Rachel kept keeping those notes in her journal. And I don't know, Rachel, if you want to talk about that.
Yeah. So, I mean, like, we had gotten this diagnosis. We were like, finally, and life was fantastic for about a week. And then we started the antibiotics. And then the first herpes hit, like, I don't know, a few days or a week later. And then it just like plummeted so far below what we thought rock bottom would be. I mean, physically, I deteriorated so bad that like I could not breathe sitting up or lying down flat. So we had to get a hospital bed. I had to be reclined at all times if I was to be able to breathe. And my mental state completely just fell apart to like such a deep low. And I ended up being hospitalized in a psychiatric hospital because of just such severe depression. And yeah, it just got really, really bad, really quick.
And you were warned about the Herxheimer reactions by your doctor. Like, he kind of gave you an upshot, which is, look, when you're killing off these bugs, they fight back. There's going to be an inflammatory reaction. Whatever your underlying symptoms are, they get worse. Although, based on what you told me, the pain was your most, frequent symptom in the beginning. And then all of a sudden, as you said, it all kind of came out. So it was like, I thought I was bad before, but this is worse. And
Yeah.
the psych part, it sounds like you were not really expecting, like, oh my God, even the depression, anxiety, right? That it all gets worse during the treatment. So
Yeah.
how long were you if you're willing to share this, because I'm sure it's a tender time with it. How long were you in the psych unit? Were they understanding at the time of what was going on? Did they at least have an understanding of Lyme and Herx's, or they were still like, oh, you need medication? How did that go?
So I was on a 72-hour hold, and thank God, no longer than that. My mom can explain about everything else. Go,
Well,
Mom.
when she ended up there, it was like, by the time we got there, first of all, you have to find, we'd gone to the local emergency room, and then you have to get a referral to a psychiatric place, one that takes adolescents. Not many of them take adolescents. And then they have to have an opening. And so it was like midnight. Midnight, they were at this place, and she was there. And she absolutely she hated us at this point. My husband and I mean, she was just like, all of her pain and everything was, directed at her parents. And but we were there, and they only had a bed that could lie flat, and she absolutely had to be at an angle. And so we were talking to them, and it turns out there was one hospital type bed in the place. that had, you could have it at a reclining angle, and we talked him into it. See, again, there's that pushy mother again. And so they were there, and it was too late they just said, you can talk to doctors tomorrow. I had brought a whole, bag of medications, and I talked to the doctor on the phone the next morning, and he said, well, he said, I used to live in Connecticut, and so I know all about Lyme disease, and this isn't Lyme disease. And, he'd seen her for 10 minutes at that point. And so,
by the way, this was the psychiatrist who told you this?
This was the head psychiatrist. This was the head psychiatrist.
Lovely.
Facility. And so he knew offhand, he knew right away this wasn't Lyme disease. And so she didn't have to be on those medications. And I offered to set up a phone meeting with our doctor and to see if I said, we could discuss this. And well, that wasn't necessary. Anyway, all of my powers of persuasion, he agreed to let her keep because we were still operating. It was a 3-day hold, let her just keep taking the antibiotics for 3 days. Mm-hmm. And there were some other things, supplements, I don't even remember. There were various things. And we just focused on, okay, you can forget about the other stuff. Just let her keep taking the antibiotics. And so he finally did. And then we went in, my husband and I went in later in the day and supposed to be a visiting time. But we met with one of the other staff people, and this guy, I think he was a psych tech, he sort of pulled us into this room and said, before we go any further, you need to know that your daughter is scamming you. And I'm like, well, what do you mean? And he said, she's not in pain. She doesn't need a wheelchair. I mean, it was very bizarre. It was very, very bizarre. It was like we had fallen down the rabbit hole into an alternative reality. And at that point, I just wanted her out. The state of California had her for 72 hours. And it was, our doctor had put me in touch with Sandy Barenbaum, and she and I, Lyme literate therapist, psychotherapist in I know you know her, but I mean, for other people that are listening, she's in Connecticut. And I remember at the time thinking, how is a person in Connecticut going to help me? And she helped me a lot. And I called her. Our first conversation was when Rachel was in the psych hospital. And she listened. And then she said, you know what? You need a plan. And so we started with a plan. And we brought her home. And another thing that was very important, Rachel did have a therapist at that time locally. And that woman was a lovely, excellent therapist, but she knew nothing about Lyme disease, but she was open. And so she and Sandy consulted, and Sandy kind of trained her remotely. And so that person was really a big help to Rachel and to all of us. And so we got to a point where Rachel didn't perceive her dad and me as the enemy anymore. We were all on the same team, and we were all trying to get her better. And really, it's not that things were perfect. They were far from perfect, but it was so much better at that point. And I think that the therapy, it has to be the right therapist. And in terms with Lyme disease, I have heard of other people that have Lyme disease and go to just kind of a regular therapist who has no understanding of what is, might be going on, and it can really be detrimental. And so it's just as important as it is to have a Lyme literate doctor, it's also important to have a Lyme literate therapist.
Right. So the point you're making, and I think for people listening, and this is really important because the family stressors that families go through, I mean, it can destroy families. I mean, I don't even want to tell you the number of people that got divorced of where either a mother, or a father was sick with it and the family couldn't stay together. So a Lyme-related family therapist for you really helped to pull it together because you finally had the understanding, right, that you were not the evil people here, right? You were just trying to help. And Rachel, she, for some reason, when Sandy was speaking to you, she was able to get through to you that your parents were not the problem, that Lyme was the issue. Was it that she was so Lyme literate, she was able to explain the whole course to you to kind of change your mental state about this? I mean, she was able to break through that through this anger and denial and everything you went through?
So I actually never spoke with Sandy. She only spoke to my mom and my therapist, but she and my therapist, they met like weekly for quite some time. And so then I was helped from Sandy through my therapist and then also through Sandy working with my mom. I have since met Sandy, but.
Got it. And what, by the way, since you have a brother in the background, I haven't heard, how is your brother dealing with all of this, with this whole situation?
Mom, do you want to go?
Well, okay. It happened that he was graduating from high school about the time that Rachel got sick. And so and then he went away to college. And it was, from the point of view of the parent, I mean, I still, it hurts my heart to say this, but it was kind of like, good, he's at college. I don't have to worry about that anymore. I can focus on this situation here. See, he wasn't home when Rachel was going to the psych hospital and everything. And it wasn't until conversations many moons later to realize that Jeremy was very worried about us and concerned about us. And when he came home, it was like life was different and everything was revolving around his sister's needs. And he felt like he was just sort of this peripheral person. And I feel like we all got through that and we have a good relationship now. But I'm aware of families, and you may be aware of this too, Dr. Horowitz, of where the sibling that isn't ill, in a sense, sort of divorces the family, kind of just goes off and says, I'm not a member of this family anymore. And so I'm grateful that didn't happen to us. But it does, I think it can be especially hard when the siblings are still in the home. But I remember, after, Rachel went through some of her more difficult episodes, sometimes I would even realize I hadn't even thought about Jeremy for, like a long stretch of time. And then I would feel guilty about that. And it was very difficult. It was just very difficult. It was very hard on every member of the family. And although I have many wonderful friends in my life, I'm blessed for that. I wasn't turning to my friends for the support I'm sure they would have happily given me, because I was so totally, to all of my bandwidth was taken up with dealing with my daughter and her immediate needs, that to even tell somebody else what was going on, even if I knew they would be sympathetic and love me and support me, it was like that was beyond my capabilities of doing. And I have one very good friend that lives across the street from me. And she had an inkling of what was going on. And one day she just said to me, "You don't have to tell me anything. Just if you need something, you just tell me what you need." And I called her up one day and said, "I need you to go to the drugstore and pick up a prescription." And she went and she did it. And it was a long time before she ever really got the story of what was going on with us, just because, all of us were so consumed by what was doing that we just had nothing extra. And now I hear from so many other Lyme patients that are in the same kind of problem, same difficulties of just you gotta, to even explain to somebody else what's going on. They just don't have the energy.
No,
And
and I
that's,
think one of the important points you're making here is that this is not just affecting one person when someone's sick in a family. It's affecting the entire family, including brothers or other sisters that are not particularly affected. And I think the point that's important for everyone listening is that, getting a family therapist, getting therapy and support for the entire family, right, is really crucial when you're going through something so difficult, because one, person like Jeremy could have felt ignored by the whole process. Like, even though it wasn't true, kids sometimes think to themselves, oh, I'm not loved as much, or I'm not cared about as much, because all the attention, right, is going to someone else, right? This happens in divorced families with kids all the time when these things happen. So you ultimately, from what I understand from your book, you ultimately found that these online Lyme support groups were really important, right, in helping you to get that support. Can you talk a little bit about this?
yes, at that time, see, now there's actually all kinds of groups on Facebook and other kinds of things. But at that time, there was something called LymeNet, which is still around. And then there were these state groups like California Lyme, New York Lyme. There was a whole collection of them. And those were really the only place that I could find um, that I could find, one, information, and two, support for what I was going through. And even though people have, excuse me, have different, experiences, different Lyme patients have different experiences. There's a commonality there, and so that is just really important. After Rachel was substantially better, I actually helped form an in-person Lyme support group in Sacramento, and I facilitated that for 8 years, and I've since moved on to other things, but that was amazing to have people come in person. And there was one woman that lived in a homeless shelter, but she would come to our meetings. She would come to our meetings once a month, and she said that this was the only place for anybody that she could talk freely about what her experiences were. And there were people, a whole spectrum of people that would come into that. And there's a very basic need to be heard, to be understood, to be seen. And most people, ourselves included, felt very unseen, certainly by the medical establishment, but in our case, also by the school system, and other just being out in public, because we weren't out in public. We were basically in our house most of the time.
Mhm.
And it just people need connection of somebody that accepts them and understands them.
Yeah, we've got some local Lyme support groups also. I know that help patients with it, and I think can be very helpful. But I will also tell you that the flip side sometimes that people have to be careful with is that some of those people in the support groups who are still chronically ill, who have not gotten better, sometimes it's difficult because you're listening to the same people's stories. It's almost like a PTSD reaction. Will I ever get help? What's going to happen? I mean, the support obviously is crucial, but I think, you have to be careful sometimes when you're a sensitive person listening to it, because all of a sudden you're listening to all these people with these stories that if you're still on your healing journey, it's a question like, my God, they've been doing this for 8 years. Will I ever get better? And of course, people do get better. And Rachel, in fact, your story as the book goes on, you did oral antibiotics, you did IV antibiotics, you did detox protocols, you did hyperbaric. Were those game changers for you? Like, did those ultimately help you? And what finally got you across the finish line?
Yeah, I mean, throughout, like, I was in the wheelchair for over 3 years, and throughout that time, we just tried, as many things as we possibly could, and we feel like they all helped a little bit. But the thing that just never wavered was my constant body-wide pain. Like, it was all the time, and it only got worse it never got better. And so it didn't matter what we were doing. I just kept having this deep pain in my bones and my joints and shooting pain and my hypersensitive shoulders. Like none of that got better. And then finally, you know, as a teenager, most of us don't like listening to our parents, specifically our moms. And so my mom would always be like, here's a new treatment we should try. And I would just turn it down. And then here's a new thing. No. And just like, I just wasn't even interested in it. But then through, and like, you know, I had friends with Lyme through online and we'd talk on the phone. And one of them had tried this specialized chiropractor and specifically focusing on the upper cervical, like the atlas of the spine. And she had been in a wheelchair and had gone to him and it had worked wonders, and she'd been able to walk and take like 12 steps, and it was this whole thing. And she was so excited about it. And she's like, you got to do it. So then I was telling my mom, I got to do this. And so then we ended up going to that same doctor, and that ended up being what got me out of the wheelchair. And it was really like, it was a specialized thing, very focused on that top vertebra. And then after 14 treatments, it was like the pain that was everywhere just switched off. And so then after that, life was very different, and I was able to walk. I still had Lyme, I still had fatigue, I was still treating it, but the pain had just, like, the thing we were searching for was the last puzzle piece. There was that specialized chiropractor.
And as you kept doing the oral and the IV and these detox, I mean, did you find that like the herxes were less over time? Like even though you would still flare and things get worse, that eventually, like it was layering like an onion, like it would start to get better. But it really was this atlas. I know chiropractors that do it, by the way. And by the way, you were never diagnosed with cervical instability because, you know, part of that, some of the people who respond to that have cranial cervical instability where it's difficult to keep their head up, they're out of alignment. Were you ever diagnosed with that, or not even specifically?
No, it was just like quite out of alignment. Like on the x-ray, I mean, like it showed it was just quite out of alignment. And the chiropractor was explaining that when everything's so out of alignment, it can really be harder for the brain to communicate with the rest of the body. And I've definitely noticed that to this day, that I continue to see an upper cervical chiropractor because when I am out, everything is worse. And when I'm in, everything is better.
So. And these were just like neighborhood friends of yours. This was just like a girl in the neighborhood who was talking to you about this, who kind of gave you this suggestion?
No, this one was a Lyme friend that I knew from online.
Okay.
So but she lived in California.
Got it. But you also had like a series of friends that ultimately came to your support in the neighborhood. And how did they help you to get through this?
Oh, yeah. I had an amazing support group of friends that I had grown up with in my neighborhood. I'm still friends with all of them. I talk about them a lot in the book. And they were my everything. They would come over after school. You know, I was out of school for a long time. They would come over after school. They would sit next to me in my hospital bed in my room. We would play games on the PlayStation and film videos. And they really kept me sane during a very, very crazy time.
That's great.
You know, it was really, it's a remarkable group of now young women, girls then, where the youngest one of the group was like 9, and the oldest ones were college age and everything in between. And they would come over, they would hang with her, they would, you know, just do things. They watched, you know, probably every episode of Gilmore Girls several times over. It was really when we were going to the chiropractor was 2 hours away. And one of the friends would come with us and just, you know, be company on the trip. And so that was really, and one of the things that I realized in talking to parents of kids with Lyme, that's not the situation for most people. You know, many kids are very isolated, adults too, but many kids are very isolated. And once, you know, particularly if you're not doing the kinds of things you used to do, school and sports and things like that, that kids just have no friends. And one of the things that that I think really, really helped us. And I know that Sandy suggests this to just about all of her clients, is that the child or the adult really needs something to be interested in. They need something that captures their imagination and keeps them going. And in Rachel's case, she and her friends really got into making little videos and editing them and putting them on YouTube and that kind of thing in just a real, just in a real big way. And that was, it was creative and it was something that they could do together. And that was, just people need something. For some people, it might be, playing the ukulele from bed or the harmonica or something. If you could do that, music or art. The girls did a lot of artwork at our house. We had lots of different art supplies, and they did a lot of painting. And that's the thing, your life can't be just about medical treatment. It has to be about other things that
No, of course.
bring you joy.
And a lot of the patients who I've treated who are better, and I joke with them, that's actually one of the first things I ask them when they come to see me is, when you're better, what is it you're going to want to do with your life? Because that throws them off. It's like, what do you mean when I'm better? It's like, when you're better and your life is better, what is your goal in life? And it throws them off. And it's true. It's a very important question to ask people, is like, what are you interested in? What do you want to do with your life? Because without that goal, that motivation, like something to work towards the future, it's kind of like it's a little bit difficult. And I've actually had some of my patients go through nurse practitioner training, PA training. Some have become doctors. Rachel, you're not interested in going to medical school at this point and joining my medical practice by any chance, are you? Because I'm getting older and I could probably use some help at this point. You sure you don't want to go to medical school in California somewhere?
No, I'm okay with that for now, but that is awesome. I love that you say that to your patients, because that is something that we actually end the book talking about that. For my part of the end of the book, we go back and forth with me and my mom, but that, like, not my Lyme literate doctor, but another doctor that we've been working with had not had that same viewpoint, and definitely, was treating Lyme and was treating detoxing and everything and working with my Lyme doctor. But this person was really giving me a limiting belief, and was like, and even when I was the one kind of saying like, oh, I want to be able to do this. And they were like, you're always going to have to kind of lessen what you're going to do. You got to be more mellow. You have to be kind of accepting that, you might not be able to do everything. And I really believed that until actually just the last few years. Like, I really believed that, like, oh yeah, I'll always be kind of sick. I'll always be on medication and stuff. And I love that you say that to your patients, because that is far from what my reality is now. And, I'm going and doing all of these physical things. I've been learning to snowboard. I did trapeze this last year. I travel all over the place. And so that is the message that we need to be able to be instilling in people that are so sick is, what, this can be your reality. And that's something that I take seriously. And I try to post a lot about that on my social media and have that be my presence, is showing, like, this is where I came from, but this is where I am now. And I firmly believe that this is what your goal should be. That's what you should be working towards.
No, that's great. So is there any other advice you would give to people, for example, who through it? I got that it's good to have a goal, you're going to get better, get a support right in place for you, know what the ups and downs are going to be. Any other advice you'd like to share with people as we're kind of finishing this off?
My advice, like what my mom said, something that's been so important to us, is find something that brings you joy, like she said. And for me, that was filming and editing videos, and it still is. And I still do that, but I definitely recommend, wherever you are, and if that's in a hospital bed in your room, find something that brings you joy, because that absolutely got me through. It's like the hardest, even the hardest of times, if you have something that brings you joy that you can do right now. Like, it's great to have goals for something that brings you joy in the future, snowboarding. But if you can't snowboard right now, find something that brings you joy right now.
Great. And Dorothy, what would be your advice to parents who found themselves in your situation?
Well, I think it's important to believe your child, first of all, particularly when there's a lot of outside forces that don't believe your child, and then find out as much information as you can, because it's, I was saying in our time, there wasn't much information. Now it's almost like there's too much information. It's but you have to find what you need, find the information that you need, believe your child, and find the support that you need to keep going, and to keep faith in that it will get better.
Yeah, that the hope aspect, it's a really important aspect because, with everything that's happened with COVID, so many people lost loved ones during this. There's a real, truthfully, a problem with depression and anxiety now in the young people and across our population. And it's made much worse when you have tick-borne. I know you know this, but Babesia makes things 3 times worse. Bartonella makes things worse. It can cause a lot of psych reactions. It's really important to know that there are answers. And, at least for me in my situation, the reason I'm even co-hosting, the summit at this point and sharing this with people is that the 16-point MSIDS model that I've been developing for the last 35, 40 years, and these pulse dapsone protocols with persister drugs and biofilm agents, I've been looking for answers for my sick and suffering patients. People know my story a little bit, but the one story for me that was the most important is getting out of medical school when I asked one of my Tibetan teachers, what was the most important thing you wanted to share with me as a physician before I went out into the world? And Lama again then said to me, Richard, the most important thing is exchange yourself with others, put yourself in people's shoes, and do for them what you would want done. And if you do this, everything will go well. And, if you put yourself in the shoes of someone who's suffering with pain, or a mom who's suffering with this, you notice a doctor just told them it's in their head. You basically go looking on a journey to figure out, like, what is this exactly? I mean, that's pretty much how I've figured this out. And fortunately, these protocols now that, I've been developing, I've got it down to 9 weeks of oral dapsone with 2-week pulses, much shorter protocols than we've done. And I'm curious, I didn't get this necessarily from your story, but like, Rachel, when you had to lie down and you need to sit up in the hospital bed, did anyone ultimately diagnose you with other MSIDS factors? Like, I had POTS dysautonomia, I couldn't hold the blood pressure, there was Bartonella, my adrenals were low, I was filled with mold toxins. Like, did they ever get a lot of these other underlying issues? Like, are you completely well? Are you mostly well at this point? Is there still part of your healing journey you're still on?
So at the time, I don't know if anyone really was talking about the fact that, like, I couldn't, sit up straight or lay down, other than just, because the thing is, it wasn't just pain, it was severe pain that caused it, but it was also, I couldn't breathe. And so I think a huge part of it is that we sort of attributed it to being super out of alignment, because that did really help that. But since then I went off to college. And when I was in college, that's when I got diagnosed with mold issues. And so then we treated the mold and the Lyme together. And that's when I was able to get off antibiotics. I was not able to get off antibiotics for 10 years straight. And so that's when we finally got off of them. And then since then, I've done some brain retraining. I did dynamic neural retraining system, DNRS. And after that, in 2018, I've been doing really well and really, really pretty stable here. Little hiccups, and then we get on it right away, and then back to.
No, that's great. Well. So we've that was a very fast hour of a discussion. This was fascinating and wonderful to speak to you both. And Rachel, you're looking great. It looks like you've been through it all. But your book, Finding Resilience: A Teen's Journey Through Lyme Disease, you've definitely been through it. And I think your book will kind of explain to people, right, the hope that really is at the end of the tunnel, right, that you don't give up, you keep at this. And again, at the time when this happened, you didn't have the tools, right, that we have right now to get people better. So I just want to thank you, Rachel and Dorothy. This was a great conversation. I think people are going to get a lot out of it, of like what it's like for families to go through this, the fact that, families therapy is really needed for these kind of cases. Don't give up, right? Believe your child, and know that the support is there, but you've got to reach out for it. So I just want to thank you both for taking the time to do this today. Rachel, I wish you well on your journey, and please consider medical school in the future. No, I'm just joking.
Thank you so much for having us.
It's my pleasure. And Dorothy, keep up the good luck with the good work with your blogs. Your blogs are great. LymeDisease.org and everybody. They're just doing great work, right? Not only in your state, but really across the United States and the world. So thank you for becoming an advocate and helping people. I know it's really making a difference. So for everyone who's been listening, my name is Dr. Richard Horowitz. I'm the co-host of the Healing from Lyme Summit. We've been talking with Rachel and Dorothy Leland about their book, Finding Resilience, A Teen's Journey Through Lyme Disease. I know you're going to get a lot of reading the book, and thank you for joining us today. And please tune in for another episode soon.